it's very interesting when you try to understand risk factors that drive diseases. Hemorrhagic stroke, to start with, is receiving far too little attention, maybe because it is more common in LMICs. For instance, in Africa, it is about 4 times more common in Africa than it is in the US, for instance. So it's understudied. And there's no magic wand for hemorrhagic stroke, unlike ischemic stroke, whereby, you can give thrombolytic therapy. If the patient qualifies, you can give thromboectomy, but for hemorrhagic stroke, no magic wand like that, So we need to understand the risk factors in order to be able to prevent it, both primarily as well as primordially. Now, it is very, very interesting that we had the opportunity of combining data from the Stroke Investigative Research and Educational Network, that SIREN study in Africa, which has indigenous Africans, with the ERICH study. The ERICH study is in the US, but it has African Americans, Hispanic Americans, and white Americans. So we looked at different risk factors to see what is the effect size and direction of effects in those 4 different populations. So it became very exciting. So it helped us to look at the interplay of ancestral, which are sometimes genetic, as well as environmental risk factors. It's like looking at people from Africa who migrated to the US, perhaps the same genetics, but now different environment, and then seeing what the risk factors are. And apart from hypertension, which cut across all the different 4 groups, the other risk factors were really, sometimes you have some that have effects in indigenous Africans, no effect in some of the other populations, or the direction is not clear in some of the other populations. So very, very exciting. So the follow-up study now is that we're going to collect data simultaneously from these different groups and do transancestral analysis of genetic factors using genome-wide association studies, using multi-omics, hopefully if we get funding for that. And then that helps us then to tease out these factors at the molecular level. But we also step back a little to look at social, environmental factors, commercial determinants, which may vary across these populations. And then that gives us an understanding of the differences. And then eventually we might be able to come up with a transancestral risk predictor engine, AI powered, for hemorrhagic stroke. And that will be really exciting.